You've talked to a lot of people. What is the most astonishing, you know, knock your socks off story that you have heard in talking to all these nurses? What is the single story that sticks out as saying, "Oh my God, I had no idea this is horrible"?
There's Steve, there's so much horror to the story, and I can't, it's hard to think of the most horrible thing, but I'll give you a simple thing that blew my mind. These patients were denied basic anti-inflammatories. We're not talking about ivermectin or vitamin C drips, or they were not even allowed to have ibuprofen. Once you got classified as a COVID patient, you went onto the protocol assembly line, and one of the things on the assembly line was no anti-inflammatories and no steroids. And ask Mark about that. Ask the nurses about that. That's unprecedented in the history of medicine. It made no sense, and it set people up who had a minor problem into having a major problem. So that's a simple one, but think how mind-boggling that is. We're talking about Advil. We're talking about people not being allowed to take the absolute thing they needed to keep their inflammation down.
But yet they'd give them remdesivir that,
They,
shuts down their kidneys and kills them fast.
Yeah.
there you go.
And loved ones and family and friends were not allowed to access them. They were kept outside so nobody can monitor what was going into these patients' bodies or advocate for them for anything else.
Right. So basically, if you get COVID, the last place that on earth that you want to be is in a hospital.
Well, I'm not a doctor and I can't give medical advice. I can tell you what I would do. I wouldn't go. Uh, I would try to keep the inflammation. I would go to a nurse. There are many nurses, and I hope they'll talk about this. There are many nurses that are now setting up their own clinics, which they're allowed to do. And I would go to a nurse like that way before I would go to a hospital, for sure.